All right, Mr. Holder, are you ready to begin, my friend? All right. You have been called out for a patient who's just having slight difficulty breathing. All right. Start off with your assessment from the beginning. No, you can stay right there. Just tell me what it is that you're going to do. You don't have to do anything. Just verbalize everything that you're going to do. Starting off with what? Scene safe. I'll give you that one. Okay. Okay. No, sir. You can stop right there. All right. Come on in to the next patient. Yeah. Come on, send the next person in. Yeah. Go ahead, go back out there. Turn on the phone, whatever you need to do. All right, who next? Come on, Miss Andrews. Let's do it. All right. Good morning, Miss Andrews. How are you? All right. You can stay right there at the door. All right. You've been called out for a patient. All right. Simple, real simple. Just having difficulty breathing. That's it. Start from the top. Scene is safe. All right. Okay. Just one. You have all you need. All right. Good. You have one patient that's at a home that's sitting up in the chair. Talking to you, said he's having slight trouble breathing. No C-spine needed. They are alert, conscious, and breathing. The airway is open. The airway is clear. Patient is breathing about 10 times per minute with adequate, pretty much adequate chest rise. Circulation, skin color and temp is warm and dry. There's no gross bleeding. Breathing rate, he's breathing about uh 10 times per minute, 10, 11 times per minute with somewhat adequate, with fairly adequate chest rise. Okay, 6 liters per minute. Okay, that's acceptable. You tell me. Does he seem like a load and go or is he a plain state? Good job, Miss Smith. That's what I'm talking about, Miss. That's what I'm talking about. Come on. There you go, girl. Come on here. Miss Andrews, come on here. Let's go. Close the door behind you, sir. All right, so it's gonna be all day now. You don't need all that. Come on. Close the door behind you. Stay right there at the door. Close the door. Come on in. All right, you can stand right there. You ready? All right, you ready? You don't need to worry about your gloves or nothing. All right. Just I need you to just answer my questions. Start from the top. All right. You have a patient that you've been called out for who's having slight trouble breathing. That's all the information that you have. You start from the beginning. Go ahead. Scene is safe. Okay. BSI. He's having slight trouble breathing, so he says. You do have all the resources you need. All right, so I'll step on back out of the room. All right, and you get from in front of my camera. Because I'm listening to him. All right, who that? Sit your hand, yeah, sit your bag there at the door. Don't worry about it. You got it. Who that, me? Yeah. Uh-huh. All right, close the door. All right. Here's Mrs. Dow. Let's do it, Miss Dow. All right. You've been called out for a patient. This is a simple call, right? Called out for a patient who's saying that they have slight trouble breathing. That's all the information that you have. Start from the top. Scene is safe. Okay.
Or is it mechanism of entry? We don't know yet.
All right. Well, if they're telling me that they have trouble breathing, you tell me which one is it.
Nature of
All right, keep going.
Okay. Do I need any additional number of patients?
All right. You have one patient.
One patient. Okay.
Mhm.
Do I need any additional research?
You have all you need.
Okay.
Okay, good.
Is my airway open?
Nope, step on outside, Mrs. Dow.
That's not what I do. Oh no, my general impression.
Okay, I'll stop you. I'll go ahead. I'll let that pass. Okay, good. All right.
Impression.
You have a patient that's maybe let's just say 40-year-old patient complaining of slight trouble breathing.
Okay.
All right. AVPU is means what? Okay. Verbal.
I mean, alert, verbal,
Okay.
pain.
Painful stimuli you're checking them for or unresponsive. All right, I'll give you that. All right. So the person is alert, conscious. Yes.
Okay. Airway open or closed?
The airway is open.
Okay. Do I need to consider C-spine? All right, I think I explained it.
All right. Is the airway?
After general impression.
Well,
After general impression, I consider C-spine.
well, before you even get to that, all right, you're on the. Well, so let's back up. All right, I'm gonna let you get to the point where you did your AVPU. Now, what are you doing after your AVPU? You said it right. You considering? Well, I thought you were going back to considering what?
I was consider C-spine.
Okay, so no C spine needed. Continue on. Your airway is open and clear. He is breathing about 10 or 11 times a minute with somewhat adequate chest rise.
That's the same thing.
Mm-hmm.
Right rhythm. You just told me that.
Yes.
And his pulse or the right rhythm and right rhythm.
And Q. What is Q?
Quality.
All right. Rate, rhythm, and quality of what?
Of his breathing.
I told you that. What do you want to know the rate, rhythm, and quality of now? You just said it.
Of his pulse.
Ah, okay.
Circulation.
All right.
It's ABC. It's
Okay, all right.
Airway, breath, and then circulation.
Okay, all right. So we got his airway and breathing taken care of. Or you said ask that question. So his circulation, his pulse rate is about I don't know 103, and strong.
103.
Mm-hmm.
Okay, so now we have to consider he's a low
Is that what you're doing next? You're still in circulation.
Oh, and the capillary.
No, ma'am.
Okay. I thought after you did circulation and
Yeah, are you done with circulation? You're saying I thought after you were done with circulation. My question is, are you through with circulation?
No.
All right. So what else do you need to be finding out about the circulation? You got it, Miss Don. You're almost there.
This is the part that I was like, I need to say because I felt like I can't remember.
Don't worry about it. Come on, think about it.
After we checked their breathing rate and we do that circulation, we checked their pulse.
Mm-hmm.
We did heart rate.
The pulse is the heart rate. I told you it was 103 and strong. What else do you need to know about the person's?
Oh, the skin color.
All right, skin color and what?
Temperature.
All right, patient is warm and dry.
Okay, warm and dry. And
Yes.
the color of their skin.
Warm and dry.
That's the
color of their skin is warm and dry. Yeah.
That's circulation. Mm-hmm. It's not capillary reflow time. It's like
not in this particular situation, right? What else do you want to know about his circulation? What else do you want to know about his blood?
I mean, I thought it was CRT, but you said no. Mm-hmm. About his blood,
right.
There's no hemorrhages.
Oh, okay. So you're asking me what? Do you notice any what?
Any lacerations?
Any gross?
Any gross bleeding?
Okay. All right.
Like
no, you do not.
That's what instead of asking if it's any hemorrhages or anything, that's why you say gross bleeding because that's the bleeding that will cause that.
Well, that's not the bleeding that will cause it. You're saying that's what it is.
Yeah, that's what
the hemorrhaging is the gross bleeding.
That's what I mean.
All right. There's no gross bleeding found. All right. So what do you want to do for your patient? And what is it? What is the patient now?
The patient is a
all right, patient's a plan state. All right. What do you want to do for the patient?
Because they're having trouble breathing, I want to put them on oxygen.
What kind of oxygen?
A non-rebreather.
All right. On a non-rebreather, I'll accept that. All right, Miss Dow.
I have one question. Is 12 the lowest you could go, right?
No, 12 is not the lowest you could go. I'll accept 12 to 15 minutes. Who's next? First of all, I need you to come to class with a grin or a smile. That's what I need you to do. Come here. Stand over here so I can tell you my scenario. All right. All right. So you have been called out for a patient who says they have a cut on their arm. All right. You can start from there. That's all you know. No, just say everything that you need to say. Start from the top. Seen is safe. Patient has a laceration to their forearm. Just one. You have all you need. BSI for who? All right, good. All right. General impression. You have a male patient that's sitting up in a chair. Says that he was working and cut his forearm with some, I don't know, with a blade by mistake. There's no C-spine needed. Your airway is open and clear. Your rate, rhythm, and quality, you mean? You have a patient, I guess, let's see, 16-year-old patient that is breathing at 16, 17 times a minute, adequate chest rise. Okay. AVPU, okay. He is alert and conscious and oriented. Okay, what about the circulation? What's the first thing you want to know about the circulation?
Skin color.
No. You do know. What is circulation pertaining to?
The breathing.
No. What is the circulation pertaining to?
It's his like if I touch his finger.
No. That is one thing, but not in this scenario, not in this situation, and not what we're asking for now. You are now at the point of circulation. You said you are checking for what in the circulation? What are you checking for in the circulation? You did start off with skin color, but that's not the first thing you need to be assessing for. What's the first thing you need to be assessing for? No. that out the way. We're on the circulation.
Do we have any injuries?
Put your hand on the neck, Miss Davis.
Oh, pause.
All right.
Oh, does my patient have a pulse?
All right. What do you want to know about his pulse?
Steady rate.
You want to know the what? RRQ. What is that? All right. I'm gonna give you the first one. Rate.
Oh, respiration.
No. All right. Go back outside then.
No.
Go on back outside. Come back when you know. Send the next person in, since you don't know it. She said. Yeah. You probably didn't hear it because you're smacking. All right. Who's that? Jazzy, where you going? Right here, Jazzy. All right, we got Jazzy here now. All right, Miss Jazzy, you ready? All right. So you've been called out for a person, 16-year-old male, complaining of a small laceration to his forearm. You can start from there. Turn around so we can hear you and see what you're saying.
If the scene is safe.
Scene is safe. Mechanism of injury or what?
Nature.
Nature of illness. All right, nature of illness. All right, you have a male patient that's complaining of a laceration cut to his forearm.
Do you want me to continue?
Yes, ma'am.
Number of patients.
Just one.
What do you mean?
Just one patient. You just asked me number of patients, did you not? What's going on with you? All right, go ahead. You have all you need. Okay.
General.
You have a male patient that's sitting in a chair that's saying that he cut his arm by mistake.
I forgot the next step.
You did.
It's A B.
You say it's what? Sound like people all right?
A B.
A B F P B. What is that?
The airway.
No. What is apple, Miss Jasmine? Miss Jasmine. Alert and what else? What's the V for? Verbal. It's a verbal response. All right. What's the P and U for? P was not pupils. You are correct. Do you know? All right, go back outside. Send the next victim in. No, man. Bro. Okay. We heard her come back here because she done looked at the thing. Now she ready to go. So, no, that. Okay. Better get ready. All right, Miss Steele, you ready, sir? All right, let's go. I know Miss Steele, you gonna rock it. Let's go. All right. So you've been called out for a male patient who has complained of a small laceration to his forearm. You start from the top. Scene is safe. Mechanism injury or what? All right. You have a male patient that's complaining of a small cut in his forearm. All you need. Okay, good. There's no ceasefire. Your person is alert, breathing, and conscious. Alert and conscious. Good. Your airway is open and clear. Are you going to post now? You have airway. You said what else do you need to tell me or ask me about the airway? Good job. Yes. Your rate is he's breathing about 16 times per minute and normal. All right, what do you want to know about the pulse? Good. He has a pulse rate of 102, 103, and normal. Or and he has a pulse rate of 102 or 103, fluctuating between the two, and it is strong. All right, skin color and tint, you mean? All right, skin is warm and dry. Good job. There is no gross bleeding other than the small laceration of blood that you see on his forearm. Based on everything that I told you, what do you think it is? Is it low blood pressure? Okay, good job. What are you going to do for a small little injury? Yeah. All right, good job, Mr. Deal. You just want to go ahead and place some gauze on it and wrap it up. Yeah, you can drink. Come on. You deserve a drink. Come on. Just feel, give it. This time, Miss Davis, since you won't go ahead and go first again, this time I will not be aiding you at all. So, because you went outside and checked, I expect that you have everything ready to go. So you will not be getting any assistance at this time. Let's start from the top. I am not intimidating you. I am going to say. All right. Question is, person out who had a small laceration cut to his forearm. Start from the top. Seen and say. Person having a small cut to his forearm. Just one. You have all you need. Good. You have one male patient sitting in a chair. He's about 16 years old and says that he cut his forearm by mistake. No ceasefire needed. Is my airway open or clear? Your airway is open and it is clear. Great. And what else? Right. Rhythm. Quality. All right. He is breathing at 16 times a minute and normal. Rhythm. My patient pulse. Is it? What do you want to know about the pulse? Uh, right. All right. It has a pulse rate of about 102 and strong. Skin coloration. Skin color and tip. All right. Patient is warm and dry. Does my patient have any lacerations? He does have a laceration in the forearm. What do you want to know about his situation before the forearm? Oh, skin color. You got skin color and tip. What else you want to know? Any what type of bleeding? Excess bleeding on gross bleeding. Good job. Okay, good. All right, so he has a small cut on his arm. That's what you found there. What else are we going with next? All right, which one do you think he is at this particular point? He's bleeding minimally. Good job. How are you going to handle this patient? What are you going to do for him? That cut, All right, that's good enough for now. Good job, Miss Davis. My time. Lord, that's a don't make me like she. I know what they saying. Exactly. All right, all right, you ready? Close the door, Miss Hope. All right, here we go. All right, you've been called out for a 16-year-old male patient who had a cut to his forearm. You start from the top. Get off that phone. Scene safe. Put that phone away. Scene safe. All right, patient who's complaining of a laceration to his forearm. Number of patients. Just one. Vision research. You have all you need. BSI. Okay, good. All right, good job. Keep going. General impression. You have one male patient that's complaining of a small laceration to his forearm. Because he do consider C-spine. All right, good. No C-spine needed. How many? It's alert, verbal. Do we do pain? This is alert and oriented. Yes. Good job. Keep going. Is he any worse bleeding? Are you going to bleeding now? No, 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 no. Go to. You go to. How many breaths? What do you want to know about the breath? What do you want to know? Your rate, rhythm. All right, rate, rhythm, and quality. All right. He is breathing about 16 times a minute and normal. And you go to. Any breath bleeding? What do you want to know about his circulation? Oh, circulation. It's oh, airway circulation. So like, is he breathing? You've already discussed the breathing. You're on circulation now. What do you want to do with the circulation? What do you want to know? What are you asking the evaluator about the circulation? Oh, is he staying skin like? All right, let me ask you a question. What did you ask about the airway? You wanted to know what about the airway? What was the RRQ? Did you not? Rate. So what do you want to know about the pulse? The pulse. Mm-hmm. The rhythm. The what? The rhythm. What else do you want to know? Quality. All right. So you want to know the what, rhythm, and quality. What's the first thing you want to know? The first thing? Yeah. You said rhythm and quality. What's the first thing you need to know? Rhythm and quality. What's the first? Exactly. All right. So he has a pulse rate of 102 and strong. The rhythm. Well, I've told you the circulation, the rate, rhythm, and quality. He has a pulse rate of 102 and strong. So, and then you go down to any, is he bleeding? Any gross bleeding? There's no gross bleeding other than the small laceration that he has on his forearm. Do is it then he goes down to load and go? Or stay and stay and stay and load and go and stay or starts with a P. Load and go, stay. Start with a P. Patient. Stay and patient? No, no, stay and P. What do kids do? Play. Stay and play. All right. So is he a load and go or is he a play and stay? Based on what you know about him so far. He has bleeding on his forearm that's minimal. Minimal? No, is he a play and stay or he's a load and go? He has minimum bleeding in his forearm. Minimum. Is it? Okay. So play and stay. What are you gonna do for his injury? What are you gonna do for the small injury that he does have? Okay, what you gonna wrap it up with? All right, that's good enough. All right, Mr. Holder, good job. All right, make sure you get your stuff down and be confident about what it is that you're saying. Okay. All right. What's next? All right, here we go. All right, you have a patient. You've been called out. That's having trouble breathing. That's all you know. Senior say, I'm sorry. Nature of injury. You mean nature of illness? Huh? Or all right. You have a patient that is having difficulty breathing is what been reported to you. Okay. What's next? Just one. You have all you need. Okay. Good. Good job. You have one male patient, about 45 years old, complaining of slight difficulty in breathing. Good. There's no C-spine needed. Good. Patient is alert and conscious. What's next? Good job. Mhm. Good. What else you want to know? You got down the general impression. You got down C-spine. All right. If you sit down with the patient, what else do you want to know about? Think about your ABCs. Ah, okay. The airway is open and clear. Uh, what do you want to know about his breathing? What's RRQ? What's RRQ? Rate. That's the Q. What's the other R? No. Rate rhythm. He is breathing about, let's say, 10, 11 times a minute. There are no instructions in your airway. What do you want to do for his airway? He's breathing about 10, 11 times per minute with somewhat adequate chest rise. So what do you want to use to help him out? What type of oxygen? Not sure. Come on now, think. See you back outside. You're almost there. Yeah, what type of oxygen do you want to put him on? You remember the stuff that we had in the class that we went over at the table? And I showed you all three of those particular devices? Okay. Okay. And what was the other one? What was the one that looked like a little rope? All right. Which one of those you want to put him on? Based on the information I gave you. How many times I say he was breathing? That's right. And I said somewhat adequate chest rise. So out of those three options, which one you want to put him on? Okay. All right. Good. All right. How much you want to put him on? How many liters you want to put him on? Good job. All right. Good job. What's next? You do. What you want to know about the post? Great rhythm and quality. All right. Pulse rate of about 102 and strong. Skin color and tip is normal and dry. There is no gross bleeding found. Good. Good job, Mr. Henderson. Good job. All right. Keep it up. Just keep studying. You know what I'm saying? You'll have it. Send Sarge back in here. You probably gonna be next. Dun, 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 dun.
Jazzy too.
Oh yeah, that's right, Jazzy too. Jazzy out there?
Is everybody?
All right, well tell them whoever wants to come in next, and I'm gonna be all day. Sarge, you ready?
I'm just doing.
You got your way to put them gloves on. All right.
Well, I'm just going to
That's fine. You can leave them on. You ain't gotta take them on. If that's what you want to do.
uh, really admit I'm having brain farts.
All right.
So,
Well, you gonna have to
Uh,
release that gas, brother. Get that farts off you. All right. The only way you're gonna do that is how? It's by going over it again, and again, and again, and again. All right. You got it right. They make you do it over.
yeah.
All right. You ready?
No, I ain't ready.
All right,
don't
so
know.
I'm gonna need you to get ready then.
I don't know it, and I'm big man. I ain't like somebody you try to guess and then you guess wrong.
Okay.
So I don't know it. I don't know it.
You know something.
I don't know. I don't know it all.
Well, we got to work on you knowing it all. Let's start from the top. You got a patient that been called out for difficulty of breathing.
Mm-hmm.
All right. You start from the top. Tell me what you need to know. What you need to ask.
All right. Same say.
Seen and say.
BSI.
No sir. All right. I'll tell you what. Yeah. That's fine. Go with me.
Go ahead. What is the mechanism of injury?
A person that is having difficulty breathing. What else about said mechanism of injury? What else you want to know in that?
And the NOI.
NOI. What is NOI?
Nature of illness.
All right. So the person is having difficulty in breathing. That's the nature of illness. What's next?
All right, I'm a resource.
You have all the resources you need.
Okay. Do an assessment. Airway. Airway.
That's not what AFPU is for.
Oh, alert.
Mm-hmm.
Verbal.
Okay.
Pain, and the U is for unresponsive.
Okay. Person is alert and conscious. Good. What else you want to know? Mm-hmm. Stuck? You want me to throw you a lifeline?
Yeah.
All right. So where are you in the scenario now? We at where? You in alert, verbal, you're non-responsive. Next thing you want to ask is, what's my general impression of my patient? All right. So what it is that you're seeing? All right. So this is you are walking up on the patient. What do I see? What's my general impression? I'm going to say you have a person that is complaining of slight difficulty in breathing. Okay. So if he's slight difficulty in breathing, the next thing you want to ask is there any C spine that is needed? And I'm going to say that there's no C spine needed at this time. So at that point, now what do you want? What is it called? What have you been called out for?
Difficulty in breathing.
All right, so what do you want to know next? Think about it. If you're being called out for a difficulty in breathing patient, what do you want to know next after everything we just mentioned? Are you telling me, or you asking me?
No, I'm telling you, I'm getting airway breathing circulation from giving me work. He's telling me it's difficult breathing, but I'm getting that.
Okay. All right. So you're going to tell me that the airway is open. All right. What else you want to know? You said so. It's okay. It's open and clear. What else you want to know?
Are there any major injuries?
No.
No, no major injuries. Okay.
Not there's no major injury. That's not what you want to be asking. You're still on this airway, right? You said that his airway was open and clear. What you need to be doing really is asking the evaluator, is the airway open and clear? You need to be asking me, who's giving you the scenario, is my airway open and clear? All right? Because I need to tell you if it's open and clear. Okay? Not that you tell me, I tell you if it's open and clear. All right? But I just let you slide with that. Okay? Because you're heading in the right direction. I don't want to kill your spirits. All right? So you're in the right direction. All right? But you need to actually evaluate it. Is my airway open and clear? Because the fact of the matter is, even though the person is talking to you and the airway is open and clear, now you need to be asking about what is concerning his airway. Meaning what? You'd be asking about his rate.
Oh, what is this?
Rate.
Rate, rhythm,
Q.
quality.
Rate, rhythm, and quality. Good. Does that make sense though?
Okay.
All right. So he has a breath rate or breathing rate of 10 to 11 and somewhat adequate chest rise. All right. Does that make sense? All right. So you at the airway. You said that, what's his rate, rhythm, and quality? I told you that it's 10 to 11 breaths per minute, and it's somewhat adequate. So what are you going to do for his airway? What are you going to put him?
I'm getting nasal cannula.
Okay. Liters per minute.
No more than 6.
Good job. All right. Now what do you want to know next?
Oh, if this is a long.
No, sir. Can't jump to that. You just done his airway. What else do you want to know? What are some of other the life threats that you can find on this person?
Check his pulse.
What do you want to know about the pulse?
If it's threading or beating.
Okay, so the question is, you know about his pulse, you want to know the rate,
Rhythm, and quality.
all right, that's what I need y'all to do. I need y'all to do both of them the same way. He has a pulse rate of 102 and strong.
Mm-hmm.
What else do you want to know? Need y'all to be systematic. I'm gonna teach y'all all to go at it the same way till you know it enough to where you can do it your own way. All right, rate rhythm quality is pulse. I told you it was 102 and strong. What else do you want to know about the circulation? What do you want else? You want to know about the circulation, not his breathing. What else is pertaining to the pulse? Skin color. All right. So you want to ask what's his skin color and start with a T. Skin color and all right. His skin is normal, warm, and dry. Now, what do you want to know about the circulation? Do you notice any what? Any gross what? Do you see any a lot of what concerning this pulse? You see a lot of concerning circulation. Do you see any gross what? All right. You see any much bleeding? Any gross bleeding? No, you do not see any gross bleeding. All right. So at this point, what do you want to do? Determine if what?
Determine if he's play or stay.
Okay. All right. Based off the information that I've given you thus far, is this patient a roll and go or is he a playing state? All right. Does that make sense?
Yeah.
All right. I need you to do it like that every time.
If you have the class, we gonna get to that.
You should have wrote it down already because I've given it to you already.
I wrote it down, but
Okay.
I'm like a parent. I have brain force.
All right.
Together like
Well, what you talking about right now, then?
I'll get with you. We're gonna get this thing down. Just in sequential.
Right. I've given it to you sequentially. What are you talking about right now?
No, I gotta get it together. I gotta do it again.
All right. So all that means is the information that you've already written down. You just got to keep going over it. That's what you got to do. You don't need me for that. You need to be looking over that every day, going over that sequentially. Just like you said, if you've written it down already, it just means that you need to go back over it again. That's all. Does that make sense?
Okay.
That's right. All right. Now I can grill you on it, but before I grill you on it, I need you to be looking at it a few times so I can then grill you.
Okay.
Does that make sense?
All right. Thank you.
Good job. All right. Send the next person. Should be Jasmine. Where's Jasmine? Come on, Miss Williams. We don't know this Jasmine. She's gonna come in later till she get this out of the way. All right. You ready? You sure?
Yeah, what's this about?
Why are you looking at this mic? You need to be looking at me. You good?
Yeah. Hit me with the light.
All right, Miss Williams. All right, here we go, sir. All right, you've been called out for a patient who has a small laceration on his forearm. Okay? That's all you've been given. Start from the top.
It's the scene safe.
Same say.
Personal protective equipment.
Okay, you're talking about your VSI?
Yeah.
Okay, all right, I'll take it.
Mechanism of injury, nature of illness.
A patient who's having a who has small laceration to his forearm.
Number of patients.
Just one.
And additional resources.
You have all you need, sir.
Is the patient alert, vocal, and oriented?
Good. Patient is alert and oriented.
Orientation. How is the patient breathing?
What do you want to know about his breathing?
Is his airway clear? Is it is this airway does he have normal breathing?
I don't know if it's clear or not. Why do I not know if it's clear?
Okay. Look in the patient's airway if they are unconscious.
What do you need to ask me then? Because you said it's clear. I said that. I don't know if it's clear. So you need to ask me what? About the airway. If the first thing you ask me is it clear, and I say, I don't know if it's clear. You need to ask me something before you ask about if it's clear. Think about it. It's not hard.
Can I see anything?
What do you have to do to ensure or see if the airway is clear?
Trauma victim utilize the jaw thrust maneuver to open the airway.
All right. So whether it's jaw thrust maneuver, that's of no significance at this particular time. But the question is, you gotta ask if the airway is open before you ask if it's clear. All right, make sense?
Yes.
All right, the airway is open and the airway is clear. Continue on, Ms. Williams.
Okay. How does the skin dry?
All right, before you go to the skin, what do you want to know about his circulation?
Is his circulation the rate, rhythm, and
Q.
quality?
Good job, Mr. Williams. He has a pulse rate of 102 and strong. What else you want to know about his circulation?
Does it have regular? You said, does it have a regular beef.
So you asked for the rate limit quality of it? Okay. So I said it was 102 and strong. Hold on. Where are you going?
I'm sorry. I got too.
You don't get something. No, you don't eat with your hands anyway. Okay, what else you want to know about its circulation? All right. You said the rate limit quality. I said that it has a pulse rate of 102 and strong. What is the other thing Mr. Council got told you guys about the circulation you want to know? What's all over our bodies? Now, what are you looking at now? Ah, what do you want to know about the skin?
The color of the skin is
Ah,
experiencing,
okay, so skin color and
say, temperature.
good temperature, skin color and temp. Yeah, skin color and temp that is normal, warm, and dry.
Okay, so yes, it's time to do the full body assessment.
No, sir, we're not going that far. To the point of it's a long way go. But what else you want to know about circulation? All right. Skin is warm and dry. What is the last thing you want to know about the circulation? Do I notice any what? Any gross?
Any gross bleeding.
Any gross bleeding? There is no gross bleeding. Good. All right. Now what do you want to say?
Laceration.
Yeah, it's minor.
Minor.
All right. So what else you want to know about the patient? Is what type of patient is this? To the low and go?
This is a play and stay.
All right, good. So it's a play and stay. What do you want to do for his forearm that has bleeding minimum?
Clean them, like a solution or something first, like that, and then a piece of gauze.
All right. All right, that's good enough, Mr. Williams. Good job. I wouldn't probably put alcohol in it. I'd probably use some saline and then dry it off and put him on the gauze as you mentioned.
Salt.
Good job. Saline. Oh. All right, you ready? Huh? Close the door. Let's get you out of here because I'm ready to get y'all in the lab. I ain't gonna never get in the lab fooling around with y'all. Oh. Yeah, that's a man. They beat you. They beat you down last time. Jasmine, Miss Jasmine, here we go. Have a person that's been called out for a small cut on their forearm. Start from the top. See the same. Got one patient. Got a patient that's complaining of a small laceration on the forearm. All right. So you got patient is having a small laceration. Number of patients, just okay. I'm going back to you for you to tell me again. Uh-huh. All right. Inside good. Okay, now patient. So you got did you see general impression? I told you, this young man sitting in the chair complaining of a small laceration on his arm. I need to consider C spot.
C.
All right. All right. So there's no need to consider C spine. ABPU. What is what? Okay. Pain. All right. Person is alert, conscious, and oriented. Now what? All right. What do you want to know about this? Before you want it, what do you want to know before? Huh? Before that? No. The pulse is not before the airway. What about his airway that I have taught you so far that you want to ask first? And I told you guys to make sure you ask this question because I'm going to throw you out of the room if you're being evaluated. Before you can evaluate his breathing, what do you need to know about his airway? You need to know if his airway is open and if it's clear. There's no way you can evaluate his breathing until you know that his airway is open and clear. The airway has to be open and it has to be clear. Because if it's not open, then you have to open it by a jaw thrust maneuver or a head tilt chin. Does that make sense? Now that you've got it open, you need to ask the evaluator, is it clear? Yes, the airway is clear, or no, the airway isn't clear. If the airway is not clear, you ask the evaluator, what do I see? You see vomit in his mouth. Okay, I'm going to suction that out. Is the airway clear now? Yes, the airway is clear. Now, if it's open, airway is open and clear, what is the next question you need to be asking about? So you want to know the rate, what else? Rhythm and quality. What's the rate, rhythm, and quality? RRQ. Okay, what's my rate, rhythm, and quality of breathing? I'm going to say, person is breathing about 10 times per minute and chest rise. All right? Wait a minute. This person here is breathing. So, in actuality, this person here is breathing about 16, 17 times a minute and adequate chest rise. All right, what do you want to know about his pulse? You should want to know the same things about his pulse that you asked about airway.
The quality.
Rate, rhythm, and quality. RRQ. Rate, rhythm, and quality. RRQ. Okay? All right. Patient pulse rate is about 102 and strong. What else do you want to know about the circulation? Why are you going back to the airway? What did I say his airway was? So why are you going back to it?
Check.
What are you talking about? You talking about reassessment? You're talking about the initial assessment. Right? Okay. So, what else you want to know about his circulation? All right. So you asked about, or we talked about his rate, rhythm, and quality of his pulse. Said that his pulse is 102 and strong. We're still on pulse or circulation. We want to know about his skin. What else? Color. All right. You gotta put your hand on his skin color temp to see what type of condition his skin is in, or what type of is he going into shock or anything. So that's how you ask to see if, or partially ask how to know that he's going into shock by assessing his skin color and temp. I'm going to say that his skin is normal, warm, and dry. Okay, means he's not going into shock. What else do you want to know about circulation? You want to know is, does he have any gross bleeding? Do I notice any severe bleeding anywhere? Because these are all life threats, right? So if you don't notice any gross bleeding, I say that no, he does not have any serious bleeding, only the small laceration to his forearm. All right. Is this patient a load and go, or is he a plain set? That's what you should be saying to me, that the patient is a load and go based on the information that you have thus far, or is a plain set. You Or you can say this patient is a low income or plain sick. What do you think he's saying based on the information you know thus far?
Can you repeat what the patient?
He has a small laceration to his forearm with minimal bleeding. All right, he's staying plain. All right, what are you going to do for the patient's forearm? What would you do for yourself if you had a cut on your arm?
Choose.
All right, clean it and wrap it, right? All right, Miss Andrew. All right, gotta work on some stuff. All right, but not too bad. All right, you're moving in the right direction. Just get a little, just tighten up just a little bit more. Okay. All right. Who's next? Is that it?
I want to make sure I'm good.
Here we go. You've been called out for a patient who has difficulty in breathing.
Okay.
You stay over there. Okay. I'm make sure you saying everything here up on my screen here. All right, start from the top.
I called to a patient, difficulty breathing.
Yep.
Seen the safe.
Sing it safe.
BSI is on.
BSI, okay.
Well, I'm gonna say I got gloves and I got masks.
All right, got your BSI.
Mechanism of injury.
Or
Okay. And
no.
how many patients?
No.
Oh, you said
mechanism injury or
nature of injury.
nature of illness.
Illness.
All right.
Mechanism of injury, nature of
You have a
illness.
patient that's been called out for difficulty in breathing. That's all you know thus far. All right, keep going.
All right, now I'm patient.
Just one.
Any additional resources?
You have all you need.
Let's see. General impression. So
Yeah, general impression of a patient is sitting up in the chair having trouble breathing.
rate, rhythm, and quality of breathing.
Or you want to know about the rate, rhythm, quality of breathing, what should you be asking?
Are they alert?
They are alert and conscious and oriented.
Are they verbal?
Yes, alert, conscious, and oriented. Okay.
Pain?
If the patient is alert, conscious,
conscious,
oriented,
okay.
all that is good.
Okay,
Yeah,
I
yeah.
want them whole.
Yeah.
Okay. So after that,
Now,
okay. Is got alert.
that means they're good.
They're good. Okay. Now I'm gonna get into my breathing. Can I get my rate of my breathing?
All right. So before you get into the breathing, you want to also ask the instructor or say if there's any need for what?
Any need for C-spine?
There's no need for C-spine. Good. All right. Now you can get into your what? Breathing.
My baby's
What do you need to know about your breathing? What do you need to be asking the evaluator?
First of all, is my airway obstructed?
All right. So my airway open and clear.
Open and clear.
All right. So your airway is open and clear. Good.
Understood.
Okay.
Can I get the rate of my breathing?
All right. He has a breathing rate of about. He's breathing probably about 8 times a minute, somewhat shallow. Not completely, but somewhat.
Okay, my circulation, my skin.
All right, are you moving to circulation now? What did I say?
So I need to go and check my rate, rhythm, and quality of breathing. So you said that his rate was.
What did I say his rate was?
You said it was. Just said.
His breathing rate of 8 times per minute
8 times per
and
minute.
somewhat shallow.
Somewhat shallow.
Mm-hmm.
So that means I need to go 8 somewhat shallow. So I'm going to put on a non-rebreather mask.
Okay.
Correct.
I
want to give him at least a minimum of 10 liters per of oxygen.
I'll take it. Keep going.
Now we're going to move on to my skin. Right.
Okay. Or your circulation.
Or my circulation.
What do you want to know about circulation?
I want to know if my skin is moist. I want to know the rate, the rate, rhythm, and quality of the skin. Right. Or do I want to know the quality of the skin?
Not the rate, rhythm, and quality of the skin, but the rate, rhythm, and quality of what?
We got breathing.
Yeah, we passed breathing. You want to know not the rate, rhythm, and quality of the skin. You want to know the rate, rhythm, and quality of what? You know it. Put your hand on your neck.
Hold on. The pulse.
The rate, rhythm, quality of the pulse rate. Okay, all right, you have a pulse rate of about 115 and strong. All right. What else you want to know about the circulation?
Circulation. I would like to know blood pressure, right?
No, sir.
I'm probably going post.
No, sir. You don't want to know about the blood pressure right now. What else you want to know about the circulation?
Told me that my circulation. Skin.
What do you want to know about the skin?
What is the condition of the skin? Is it
All right. So the question you want to ask about the skin, I'll help you with this. Is you're in the right direction. You want to know what is the skin color and temperature of the skin.
skin color?
All right. That's going to let you know the person is probably shocking or going to be shocked. All right. So you want to know and ask the evaluator, what's my skin color and temperature? Go ahead and ask the evaluator.
What's my skin color and temperature?
All right. The patient has skin that is somewhat cool and slightly clammy. Slightly.
Cool and slightly clammy. Cool and slightly clammy. We got
Okay.
so.
All right. So,
so after diagnose the skin, I'm going to move on to. Okay,
right,
so now do I get into my? I need to get into my assessment.
So here we go. All right. So in this particular point, you notice that the color is the skin is somewhat cool, slightly clammy. All right. So that's just something you need to note. If you note that, that means it's telling you what about the patient. He may be slightly
Cool.
clammy.
Dehydrated.
What are you checking for in the circulation? You want to know if he's starts with the S. He's going into shock. He has some sort of shock issue going on with him, okay, at this particular juncture. All right. He's compensating right now. All right, so that's fine. Okay. Now, what else do you want to know about his circulation? So we got skin color and temp. We got the pulse rate, rhythm, and quality. All right. What else do you want to know about circulation or the blood?
Circulation.
Do you want to know if he has any what? Notice on him.
Decap or BTLS.
No. We're still in circulation. Any gross what?
Gross.
All right. Any gross what? Start with a B. We're in circulation. In circulation, and when you're looking to see if he has any growth, and it starts with a B. Growth of what? B. You want to play hangman and put the letters up there?
Yeah, because I'm really.
You want to notice you're in circulation. You're checking to see if he has any gross bleeding. He has any gross bleeding that you see. All right. Is there anything that you notice where he has a whole bunch of bleeding?
Okay, so that don't go under decap BTLS.
Not right now. No, that's not until your secondary. You're still in your initial assessment. All right. Now, because you need to determine whether these things are life threats or not. All right. So, in order for you to do that, everything what you just told me, or we just told you, what do you need to be knowing or trying to figure out now about the patient?
If we can stay or play,
or
we need to go ahead and transfer.
All right. And based on what the information that you know thus far, and everything that we've covered thus far, which one is it for you?
For me, based on all the information I was given, we could stay and play, but I'm gonna go ahead and finish my assessment and go ahead and transport.
I just need to know which one you.
So we're gonna go ahead and transport.
Breathing
is too shallow.
He is a load and go.
Skin is cold and clammy.
All right. All right. That's it. That's all I want y'all to get to today. All right. Good job.